Hi, my name is Dr. Cheeseborough, and I wanted to give you some tips on how to care for your Jackson Pratt drain. There are a few components to know about. This portion, which is the white plastic tubing part that has holes throughout it, is actually inside your body, so you probably won't see this part. What you will see is the plastic tubing that protrudes through your skin and connects down to this bulb at the end. This bulb does also have an important thing to know about, which is the cap that allows you to create a seal by placing the tubing in this cap inside the tubing. There are a few things to know about caring for your drain as it comes out of the skin. It'll come out of the skin somewhere around the area where the transition occurs from the white part of the tubing to the clear plastic. There will be a stitch holding the drain into your skin. It's important to keep this area clean and dry, whether that means you have used soap and water to keep it clean and then put a dry gauze over it, or in some cases your doctor may instruct you to use a dry gauze with a clear plastic dressing called Tegaderm over top of it. Either way, do keep an eye to make sure that the area where the dressing is does not become red and irritated. So a couple of things to also tell you about is how to strip your drain. Your doctor may instruct you to strip the drain to encourage the fluid to leave from your body all the way down to the end of the bulb. This is usually done by washing your hands with soap and water. You may or may not choose to then use gloves. And then in order to facilitate stripping the drain, I encourage you to get an alcohol wipe to place it around the tubing, pinch the tubing like this between your thumb and forefinger. Also pinch the drain on the top side, right where it's coming out of the skin, so you create a nice tight grip. Hold the tubing where it's coming out of the skin and then strip down away from your body so that you can force the fluid towards the bulb. It usually takes a couple of times of walking the alcohol wipe down the tubing in order to force that fluid down. You can't do it in one particular strip. So all the way down the length of the tubing, continuing to march all the way down to the bulb until you've gotten all the fluid out of the tubing and into the bulb. Now at this point, you'll want to open the top of this cap to allow the fluid to come out. You'll do this several times a day to record the output coming out of your bulb. So take the top off, don't point it towards yourself, because if you do, you may get a splatter in your face. So point this away, take the top out, and then you'll have a cup that will be given to you by your nurses in order to empty the drainage output. So you'll turn the tubing over, squeeze the fluid out, and then as you're holding this bulb, again, squeeze the air out, replace the cap, and that will allow you to create a suction seal. Because we don't actually have this drain inside of the patient, we don't actually have a vacuum, so it won't hold suction right now, but it would do so when it's in your body. A couple of things to also think about is where do you keep this tubing, because it can be a lot of tubing hanging out of your body. So there's this tab that's on the side of your drain. You can either place a lanyard through this loop, or you can also consider putting a safety pin to allow you to hook it to your clothing so that you don't have it dangling or otherwise just loose on your body. A couple of other things that are notable about drain care. There are things you want to look for. We mentioned earlier where it comes out of the skin, you want to look to make sure there's no redness or drainage around that site. You also want to keep an eye out to make sure that the contents of the fluid coming into the bulb don't change significantly. Over several days, you should notice that the drainage output goes from a bloody drainage to a more straw-colored fluid, almost like a light Kool-Aid color. That's a normal transition in color. And you should also notice a steady decrease over several days in the amount of output coming out. If you all of a sudden had more blood coming into your drain, that would be something you want to call your doctor about. Typically, the drain will stay in place for about 1 to 2 weeks, depending on how big of a space you had for your surgery. And when the output is less than approximately 30 cc's over the previous 24 hours, your doctor may consider removing the drain. Again, every surgery is different, and so please speak to your doctor before holding them to that 30 cc mark, but that's on average what we're looking for. Also, if the drain begins to protrude through your skin, meaning you start to see this white portion, that would also be something you want to let your doctor know about, because that could mean that there's a loosening of the stitch near the skin, and you may need to go ahead and have that drain removed. For any other concerns, such as concerns around the incision, like redness, drainage, pus, fevers, these kinds of things you'd want to call your doctor about, because there's signs that there could possibly be a problem, such as an infection. So keeping in mind that these drains are somewhat obnoxious as a patient, they are very important to drain the fluid away from the surgical site. What that means is that we've done something unnatural to your body by having surgery, and we have this natural response to create lots of extra fluid in order to bring healing factors into the surgical space. And the drain's purpose is simply to remove the excess fluid that your body cannot absorb. That's why we use that 30 cc's per day mark, because that seems to be about what your body can handle. So these drains are very important. They do a good job of removing that fluid, but they are also a foreign body, so we'd like to get them out when we can. So for any questions, please refer back to your doctor's specific instructions, but these are just some basic ideas for how to care for your Jackson Pratt drain.